Imagine you have been around someone with a health concern, and now you want to know if you might have been affected too. It is a natural feeling to want peace of mind, especially when it comes to something invisible like an infection. Today we are going to explore a really helpful tool for this exact situation. A TB blood test for exposure screening is a sophisticated medical tool designed to detect if your body has been infected with the bacteria that causes tuberculosis. It is a direct and accurate way to determine if you have been exposed to Mycobacterium tuberculosis, which is the specific germ responsible for TB. This test helps identify if you have the TB infection, not necessarily if you have active TB disease. The reason this test is so effective is that it looks for a specific immune response within your blood. When you are exposed to the TB bacteria, your immune system reacts by producing certain substances. This blood test, known as an interferon gamma releases assay, or IGRA, measures these specific immune system markers. It is highly specific to the TB bacteria and generally not affected by prior BCG vaccination, which is a common TB vaccine given in some parts of the world. This makes it a very reliable indicator of TB infection. Getting this screening is quite straightforward. First, a healthcare professional will draw a small sample of your blood, just like any other routine blood test. This sample is then sent to a laboratory where it is processed and analyzed for those specific immune markers. You do not need to do anything special to prepare for this test, and the results are usually available within a few days. If your test comes back positive, it means you have been infected with the TB bacteria, and your doctor will then discuss next steps, which often involve further evaluation or preventive treatment. An interesting detail about the TB blood test is its ability to differentiate between latent TB infection and a previous BCG vaccination. Unlike the older TB skin test, which can sometimes give a false positive if you have had the BCG vaccine, the IGRA blood test is much more precise in identifying actual infection with the TB bacteria. This precision is a major advancement, helping doctors provide more accurate diagnoses and appropriate care without unnecessary follow-up due to vaccination history. Understanding the TB blood test empowers you with crucial information about your health, especially after a potential exposure. It offers a clear, reliable way to detect the presence of TB bacteria in your system, guiding you and your healthcare team toward the right preventative measures and ensuring your well-being. This early detection is key to managing TB and preventing it from developing into active disease.